My name's Siobhan Dolan. I'm one of the doctors here at the Comprehensive Family Care Center at Montefiore Medical Center, and we're going to be taking you through the prenatal care clinic this morning so you can see what we do to work with women to provide them with excellent prenatal care. What we do during prenatal care is talk to women about a whole host of issues, provide them with lots of advice for their pregnancy, and help them detect any problems that come up throughout their pregnancy. By doing this, we can help women have healthier babies, babies that are less likely to be premature, and we can also help women with their own health. Jamie, good night.
I just hope everything goes smooth, that I don't have no problems with the baby. So a lot of things go through my head. You have to monitor how your baby's doing. You have to.
How are you?
Good.
Good, nice to see you. How are you feeling?
Good.
Good. So at every visit, what we'll do is follow a woman's blood pressure and weight. What we want to do is get their baseline blood pressure and weight when they first check in, and then see the progression over the pregnancy. The idea with weight gain is you don't want to gain too much weight and you don't want to gain too little weight. You want to gain just the right amount, and that's kind of tricky to do. So let's listen to this little, do we know, little boy or little girl?
Little boy.
Little boy. Oh, that's exciting. Do you have names picked out?
Just one. I know what's the name already.
Oh, you know it's it. Okay, are you telling or you're not telling?
Yeah, I'm telling.
Okay, what is it?
Michael.
Michael. Oh, that's great. I love it. Very classic name. Good for you. Okay, at a prenatal visit, what we do for ongoing visits is measure the size of a woman's fundus, it's called, which is the uterus, which is growing as the baby grows, and then we listen for the heartbeat. Okay, so we'll do that right now. You can feel right up here the top of Jamie's uterus, which is now grown above her belly button to hold the baby. The fundus, we call it, usually gets up to about the belly button at 20 weeks, which is the halfway mark of pregnancy, and then starts to grow above the belly button after the 20-week range up to 40 weeks when we have the baby. Or we hope to have the baby, right? What do you think? Is Michael coming early or late or on time?
Hopefully on time.
Hopefully on time, absolutely. I am so with you. Good. And as we measure, it's 29 centimeters and Jamie's 29 weeks, so that's exactly what we expect. It's this really nice little trick of nature that the number of weeks equals the number of centimeters. Okay, and here's the Doppler. Wow, that's a runner in there. That kid's moving.
I love coming because I love to hear the baby's heartbeat. Like, it makes my day. I know my baby's fine, and after that, everything's okay for the rest of the day.
Heart rate's 143, so that's wonderful. Good. So Jamie, we'll be ordering some blood tests for you today, okay? At this point in gestation, around 28, 29 weeks, we give your body, you drink actually, some liquid that's like soda, and it's really a sugar load. And then we check an hour later to see how your body handled that sugar. Okay. So we do that test today. We do some additional tests to test your blood counts to see if your body's still making enough iron, and we test for some infections. Okay? Do you have any questions?
No.
Okay, so we'll get your blood work and we'll let you get out of here, and we'll see you again in about 3 to 4 weeks.
Okay.
Okay, take care.
All right, thank you.
Depending where you live, you might know where you're going to go for your prenatal care, but if you're not really sure, there's a bunch of things you can do to find good prenatal care near you. Number one is to ask whatever healthcare providers you've already worked with, either a family practitioner, an internist, or even your pediatrician can help you identify a doctor who can provide you with good prenatal care. You can ask your family, you can ask friends, you can ask your girlfriends. Someone who's had good prenatal care can point you in the direction of care. If you find yourself in a situation where you need to find free or low-cost care in your state and you don't know where that is located near you, you can call 1-800-311-BABY. That's 1-800-311-2229. If you need that information in Spanish, you can call 1-800-504-7081.